Hello and welcome to our video instruction on how to use your infusion set. Please note that this guide is not a substitute for professional medical advice or for reading the instructions for use which comes with the product. Please refer to the most recent instructions for use for a complete list of warnings and precautions. When using the product for the first time, do so in the presence of a healthcare professional. The infusion set has a soft cannula inserted at a 90-degree angle and comes with an integrated insertion device for fully automatic insertion by the touch of a button. Here you can see the parts of the infusion set. Insertion device, holding the cannula housing with soft cannula, disconnect cover, release button for the insertion of the infusion set, indication for the tubing direction, adhesive tape with backing paper. Tubing, site connector, protective cap for site connector. Before you begin with the insertion, check the sterile packaging. Do not use the infusion set if the packaging has been damaged. Wash your hands with soap and water before inserting the infusion set. Choose an insertion site as recommended by your healthcare provider. Check that the insertion site is free of skin irritation. Do not use an area right next to your previous infusion site. Clean the area for insertion with a disinfectant as directed by your healthcare provider. Be sure the area is air-dried before inserting the infusion set. Open the blister pack and take out the contents. Gently pull to remove the backing paper from the adhesive tape. Be careful not to touch the adhesive tape. Remove the disconnect cover from the insertion device by gently squeezing its sides while pulling it straight out. Keep the disconnect cover for later use. Before placing the insertion device against the skin, note the arrows on the insertion device showing where the tubing will be connected after insertion. To insert the infusion set, gently stretch the skin and ensure that the surface is flat and taut. Position the insertion device on the skin and press the release button completely down. The insertion is complete when the insertion device is released from the cannula housing with adhesive tape. The product is now in safe mode with the release button pressed down. Gently press and massage the adhesive tape onto the skin. Change to a new product and a new site if the adhesive tape becomes loose. Remove the paper from the tubing. Follow your pump manufacturer's instructions for use to connect the infusion set tubing to the pump reservoir and pump. Remove the protective cap from the site connector. Keep the cap for later use. Prime the tubing according to the instructions provided by the pump manufacturer until insulin dispenses from the needle. When priming the infusion set, hold it with the needle pointing down. Ensure there are no air bubbles remaining in the tubing. Never fill the tubing while the infusion set is connected to your body. Consult your pump manufacturer's instructions for use for further details about pump connection and filling of the infusion set. Place a finger on the cannula housing and push the site connector straight in until you hear a click. Fill the empty space in the cannula following your pump manufacturer's instructions. This infusion set allows you to temporarily disconnect your pump without having to change the infusion set. Before disconnecting, wash your hands with soap and water. Place a finger on the cannula housing, gently press on the sides of the site connector and pull it straight out of the cannula housing. Place the protective cap on the site connector. Insert the disconnect cover into the cannula housing until you hear a click. Before reconnecting, wash your hands with soap and water. Remove the disconnect cover by placing a finger on the cannula housing and gently squeezing the sides of the cover. Pull the cover straight out. Remove the protective cap from the site connector by gently squeezing both sides of the site connector and pulling the protective cap off. Prime the tubing according to the instructions provided by the pump manufacturers until insulin dispenses from the needle. When priming the infusion set, hold it with the needle pointing down. Ensure there are no air bubbles remaining in the tubing. Never fill the tubing while the infusion set is connected to your body. Place a finger on the cannula housing while pushing the site connector straight in until you hear a click. Now you're ready to restart your insulin delivery. We hope you found this video helpful. For further information about the infusion sets, please contact your local infusion supplier or Convatec Infusion Care.